a lot of our patients will respond to a full general functional medicine approach. Their eczema is better, and it's nothing that you've addressed. You move them through sinusitis, or you move them through asthma without specifically working on it. Now, here's somebody we're addressing directly. He comes with atopic dermatitis. That's the primary complaint. This is an 8-year-old boy who's got head to toe atopic dermatitis. In fact, his mom has thrown him around the country. He's been on methotrexate, Protopic. He's been on steroids, many rounds of antibiotics. Skin prick testing, which wasn't perhaps the best way to go about attempting to define his reactions, because he's covered in eczema, only identified eggs and pecans. He was very self-conscious. I've seen this in kids quite a bit. I mean, the eczema can be, disfiguring when it's all over your face, and kids can be really self-conscious about it. And so he refused to go to school. Mom started to homeschool him. So very high anxiety with the condition and just not responsive to anything. This, by the way, wasn't my case specifically. This was a clinician that I consulted with. And so here's his IgE, and you can see he's reactive, moderate to high to every single food tested, every single food. He does not have anaphylaxis to anything, but you can see he's absolutely reactive to everything. Clearly, this is, intestinal permeability. That's what we're looking at, a severe intestinally permeable gut. And allergic sensitization itself requires some barrier permeability, as I mentioned earlier. So even if there was just one, that original sensitization journey required barrier permeability. And so sometimes you might want to think about that. Even if you're not going to remove the food, you may want to think about doing a 5R or working with intestinal permeability specifically. IgG, he only had a few reactions, dairy and egg. He had a very modest reaction to wheat, but not remarkable. IgG actually acts as an IgE blocking antibody, as I mentioned on earlier. And maybe he doesn't have IgE or anaphylaxis to egg or dairy because he is, or a severe IgE because he's got robust blocking antibodies, IgG blocking antibodies. Perhaps, we'll never know. All right, the clinician enacted again, a basic 5R protocol. She opted to pull out all of the +2 and greater foods. So that's concerning, and for a long time, for 12 weeks. So you're concerned about potential nutrient depletion here, and I'll show you, in a kid with atopy, we want to be paying attention to the potential for increased hypersensitivity when you reintroduce the food. So a loss of tolerance when there's a long-term elimination. Those are two big risks here. But she concurrently, gave him other really important interventions. A probiotic blend, bovine immunoglobulin with glutamine for permeability, zinc citrate, flax oil, and evening primrose oil providing gamma-linolenic acid. I think she was concerned about, the fish oil, possibly exposing him to some fish protein. I don't think there's a concern there, but she was, just erring on the side of caution. There is some nice literature on probiotics alone helping eczema. And so here's a citation if you're interested in chasing it down. Different bifido and lactobacillus species. Here's his follow-up. Here's his follow-up labs. And, his skin responded likewise. His eczema cleared up almost immediately with the start of the diet and the protocol in general. And you can see with this follow-up lab that, his gut has responded well, and his immune system has responded quite well. They've expanded the diet with him, and he is able to tolerate all of the foods with the exception of dairy. So he has periodic dairy exposure at grandma's, and that will start him itching. And so he's actually quite committed to avoiding it. But it's a good case. He was able to move through the protocol. His mom had to order specialty foods online. She had to order game meat and stuff like that, but they actually hung in there and they did it the full 12 weeks and really turned him around for the better. I don't think, you know, in hindsight, 12 weeks is needed. I think that they could have cleaned this up a lot sooner. And, you know, as I said, I might be a little bit mindful around the duration. However, you know, my hat's off to her. She did a great job. This child responded. He's balanced and he continues to do well as far as I know. Are avoidance diets still warranted in children with atopic dermatitis? So this comes from Sampson and his team over at the Jaffe Food Allergy Institute. They're arguably the, you know, the leading clinical research scientists in this arena, and I pay attention to what they have to say. They say although food avoidance may improve AD, avoidance diets don't cure and may even have detrimental effects such as progression to immediate type allergy, including anaphylactic reactions, and may significantly reduce the quality of life in patient and families. I think we need to be mindful around you know, those of our patients with IgE. We want to be kind of prudent with how many foods we eliminate and the duration that we might eliminate. However, one thing that they've missed is the underlying imbalances aren't addressed in the conventional medical arena. So the full 5-hour approach that this 8-year-old experienced isn't generally prescribed. And I think we can't underestimate the benefit with patching a leaky gut or restoring levels of vitamin D, if only that, quenching inflammation with some EPA and DHA and so forth. So that was an inside-out approach to eczema, and I'm going to give you a different case. I'm going to look at an outside-in approach here in a little bit. But before I do, I want to tell you about Taylor, who was 21 when he came to my practice with chronic headaches, severe headaches, and sinusitis. He's only 21 years old. He's already had sinus surgery. He's been maintained on many rounds of steroids, many rounds of antibiotics. He's been referred to a lot of doctors. In fact, this case, he came to me when I was at a tertiary care pain center. And so he had, you know, failure after failure after failure in with many providers. And they finally sent him over to pain management to manage his headaches. And then I was there and they referred him back to me, and he was game to see the naturopath. So good for him. He was a skeptic, however. He didn't want to do elimination, but he humored me. He saw the positive labs. He had some IgG and he ran those by his allergist. His allergist said that they were absolutely worthless, but I suggested that we just do a finite elimination and, you know, we'll challenge. You know, to just humor me basically. And he was willing to. I think the findings, even though his allergist poo-pooed them, I think the findings were high enough that he thought, okay, why not? Let's see. So I did some environmental allergy testing on it. I'll show you those results in a sec. We did a probiotic blend, some fatty acids, some magnesium, again, an intestinal permeability powder, vitamin D, 6,000 IU. I did some enzymes, digestive enzymes with a little bit of HCl with him. All right, here's his IgG. You know, the heavy lifter here again is dairy with him. He's got a little bit of an ag reaction. So we did an elimination based on just those two. And then here's his inhalant reactions. The major player here were dust mites. And you can see his total IgE is very high. So primarily we're looking at dairy and dust mites. He was going to a school in typical New England Ivy League school, really old, you know, really dusty, really moldy. I suggested for the dust mite protocol, I suggested he keep a symptom diary, inside buildings, outside buildings, where, foods, etc. We started him on sublingual immunotherapy for dust mites. We did a saline nasal spray or neti pot. We did, you know, just a full dust mite protocol, which is in the toolkit and is very helpful. A few other things that we did for his dust mite protocol. It did end up being his dorm room where he reacted. Here's the dust mite protocol, and here are the HEPA filters. So he had to move. He moved to an off-campus housing and did much, much better. Plus, he did our protocol, and he was on sublingual immunotherapy. There are some case reports, migraine headache being associated with dust mite allergy. And here's the neti pot that that we used with him, and instructions on using a neti pot. So just I want to talk to you a little bit about nasal irrigation for chronic sinusitis patients, but I just want to give you the complete case with Taylor. So we nailed down the dust mite issue, and we were able to remedy that with the, just using the dust mite protocol, and eventually having him to move into off-campus housing, and he did fine there. That seemed to be associated, so the dust mite reactivity seemed to be associated with headaches. With his foods, he did a reintroduction and did fine. However, so he was, as far as he was concerned, he was not reactive to any foods, except on day 3, he developed, a nasty sinusitis and was bedridden. In his mind, it was coincidence. It didn't have anything to do with the elimination. I was able to convince him to try it again, just dairy, give me 2 weeks of impeccable dairy avoidance, and then challenge again. Let's just take this as a science experiment. And see whether there's anything. He's here, he's taking the time to be with me, he's following the other interventions, we're getting some good results with him, so let's just do this final piece. And I was able to convince him to, again, do another elimination. The same thing happened. He did the elimination over an abbreviated time period, was fine, no sinusitis. Upon reintroduction, 3 days later, full tilt sinusitis again. And at that point, he was convinced, and he continues to this day to be dairy-free, and he's gotten on with his life. So for him, it was two dust mites and dairy, and taking care of the underlying issues, doing some desensitization work. He's last I heard from him, he was actually doing some really neat work in Peru. Taylor responded well to a basic protocol. He used a neti pot, or he used a saline rinse, and we did desensitization work with him, and some foundational interventions. Other folks in our practice who have really refractory, difficult sinusitis, we might use nasal irrigation. This is a very helpful tool for some sinusitis patients, and they may start needing nasal irrigation, and then as you do the underlying work, they no longer need it. I have folks who have chronic sinusitis jump right into doing a nasal irrigation protocol at the first sign, and we can nip many a sinusitis in the bud. And here's an example of a protocol we might use. Berberine, alicillin. I use a lot of alicillin drops, or a liquid botanical antimicrobial product. You can put it in the reservoir, start low, and have patients just determine what they can tolerate. And it works. It consistently works for us. You can also compound ketoconazole and xylitol. You can use intranasal glutathione. I've done that as well. In fact, one sinusitis patient I'm thinking of who had it multiple times per year for decades responded to our protocol. And I did nasal irrigation at first sign, plus I did intranasal glutathione with her. And I just talked to her last week, and she hasn't needed either in, I don't know, maybe 6 months. So she has an immunodeficiency. She's low IgG subtype 2, and actually she has some CD cell imbalances as well. So she's a challenging sinusitis patient, and I expected her to just need this protocol for life, but she hasn't required it for quite a while. So kind of a neat outcome for her. Just to point out the severity, the potential severity of dust mite allergy. I think it's ubiquitous. So many of our patients have dust mite allergy, but there are a handful of folks who have severe reactivity. And this is another patient in my practice who needed to be exquisitely careful with dust mite exposure. He's got shrimp anaphylaxis. And you can see here when we looked at cross-reactive components, he's reactive to tropomycin in both dust mite and shrimp. And that tropomycin protein can exert a pretty profound, or be associated with a pretty profound clinical response. And I think that's what we're seeing in some patients, and possibly in the case I just presented to you before, Taylor, although I didn't test him for tropomycin specifically. All right, so some of our cases take extra sleuthing, or just a little extra effort. This was a patient who was referred to me for eosinophilic esophagitis with right-sided facial numbness, and she had had this for 2 years. Severe dysphagia, right-sided numbness. She'd been to the hospital multiple times with achalasia, and requiring steroid tapers, IM Benadryl, and so forth. History of GERD, history of significant seasonal and inhalant allergies, eczema, contact dermatitis, kind of the works under the allergy umbrella. Many food sensitivities. The ones highlighted in green were our cross reactions. She's got a lot of inhalant reactions as well. She's got anaphylaxis to wasps, sulfa, and Cipro, history of lots of medications, a lot of steroids over the course of her life, on PPIs and other acid blockers without much benefit, always on an antihistamine, and travels, has EpiPens. Her IgE reactivities are unremarkable. You can see her total IgE down at the bottom is high, demonstrating an allergy bias, but she's got a little bit of almond reactivity. She's got a little bit of egg. I think her big issues are these cross reactions. When we look at her inhalant panel, you can see she's got a strong reaction to Timothy grass. She's got a strong reaction, or not actually a fairly modest reaction to birch, but clinically she reacted to birch cross-reaction foods strongly. She's got a cat dander allergy down at the bottom, and over on the right-hand side, you can see she's got an IgE reaction to Candida, which plays in interestingly in her case. We did an elimination cross-reaction free diet with her for 8 weeks. It was paleo, so we dropped the sugar, just seeing the Candida reactivity, dropped the carbs. We pulled her off of all previous known reactions. She was on a very austere diet with us for a period of time, and then we expanded it as soon as we could. We pulled her off of all her major cross reactions. She worked with our nutrition team, and they paid close attention to nutrient adequacy, and we added supplements as needed. Just during this time, we were very attentive. I also used sublingual immunotherapy with her specifically for environmental allergies, so grasses, trees, molds, dander. We did again a gut repair protocol, glutamine for intestinal permeability, some antimicrobial berberine, zinc carnosine, which I think is fabulous for intestinal permeability. I do, by the way, use bovine serum immunoglobulin, but I don't think I'm presenting any cases here, but just as an aside, I think that's a good intervention as well. We did probiotics, we did prebiotics, foods, DEA. I used quercetin, C, magnesium, B complex, a good therapeutic dosage of EPA and DHA, as well as GLA, some enzymes, and I gave her sodium bicarbonate. So again, in your cheat sheets at the end of this deck, you'll see how I use sodium bicarb. It can be quite helpful for folks in turning off an immediate allergic response. So it increases pH ever so slightly and can inhibit, histamine mast cell degranulation and histamine. And for her, it was very helpful. So she just used a smidge of it. I know there's some argument out there, or we've actually had some discussion in our rounds, that sodium bicarbonate could have, inhibiting stomach acid actually promote the allergic response. But I have not seen that in practice. Here's a cross-reaction between food and environmental allergens in your toolkit. It's helpful, and you'll see that we've broken it down to where you can pull out the most common cross-reactions, and then if need be, go to the less common ones. That's been essential for us. Otherwise, we're pulling people off of way too many foods. So here's a page out of her diet that we prescribed her therapeutic intervention, and we include as much of what she can do, and minimize what she can't do. So you can see that there are lots of options for her. She worked very closely with our nutrition team to come up with recipes and where to go for restaurants should she want to eat out, how to shop, etc. Making sure she was nutritionally replete. Just very important in the underlying design, making it doable